Canada has a population of 36.4 million people. According to the 2011 stats, there are more than 6.3 million people who live in rural communities in Canada. A large number of these people consist of Aboriginal Canadians. Individuals living in rural communities have lower socioeconomic status and lower education compared to those living in urban Canada. Along with this, they also have poor health statuses and require greater needs for primary health care. Poor health status contributes to lower life expectancy and is related to an increase in mortality and morbidity rates. These people are living with many health challenges that include hypertension, diabetes, arthritis, and mental health illnesses. Rural Canadians have increased health needs and have geographical barriers to accessing healthcare because healthcare facilities are limited and they are more dispersed as compared to urban areas in Canada. Along with this, infrastructure in most rural areas are underdeveloped and there is an extensive travel time to accessing medical services and specialized medical care.
Of those who reported difficulty accessing services, waiting too long for an appointment and difficulty getting an appointment were the most common problems reported, which can lead to complications such as negative impacts on obstetric care, reduced quality of life, and increased mortality rates. In terms of obstetric complications, an increase in stress for women who travel more than an hour to access maternity services is associated with preterm labor and spontaneous abortion. Also, women from rural communities have a greater chance of having complicated deliveries and premature births compared to women giving birth in urban communities. As for reduced quality of life, delayed access to healthcare results in increased pain, suffering, and mental anguish, reduced productivity and increased absenteeism due to the reduced ability to work, and patients' condition could deteriorate while they wait, which may lead to permanent disability as well. In terms of mortality rates, approximately 44,000 Canadian women may have died from increased wait times between 1993 and 2009. In the 2005 Kahlui decision, the Supreme Court of Canada noted that patients die as a result of waiting lists for universally accessible health care.
What is the nurse's role? Nurses provide direct care to their patients and therefore play a key role in building a therapeutic relationship with their patients. This involves actively listening to their patients' concerns and advocating for better patient outcomes. The next step, after being well educated on the issue, is to bring awareness on the inequities that exist in healthcare access in rural areas versus urban areas, and to form a coalition. A coalition is a group of people that come together to achieve a common purpose. Nurses then collaborate with larger organizations such as CNA, BCMU, and ARNBC to gain more support. Awareness through an education campaign or through committee meetings and flyers help to create public support. Once enough support is established, nurses proceed to taking political action. They can lobby politicians to vote a certain way on an issue and work on advocating for policy change.
Currently, the federal government is responsible for transferring healthcare funds to provinces and territories as long as they meet the principles of the Canada Health Act. The stakeholders and the community must work together to hold the federal government to more responsibility than just the allocation of funds. The federal government must become active and collaborate with its partners and all Canadians, government stakeholders, individuals, families, businesses, and volunteers, to develop new health policies and update current ones with an even stronger focus on the primary health care principles. There is not enough support for healthcare workers in rural Canada. Money incentives are not enough to retain healthcare workers. The government must establish programs with targeted funding from all levels of government to enable rural family physicians and other specialists to obtain additional or enhanced skills training in order to improve access to healthcare services in rural communities. The government should create and support a Canadian Rural Health Services Research Network with the goal of connecting existing rural health research initiatives and coordinating and strengthening research that enhances the healthcare of rural Canadians. They should also promote and facilitate the use of research-informed evidence by all organizations participating in rural workforce planning in Canada.
Other strategies include providing transportation options that are accessible, affordable, and readily available to enable access to healthcare, including ground, air, and water transportation, as well as public transit and shuttle bus options, as well as support aging in place through increased home supports and assisted living in residential care spaces. We will advocate to make inequitable access to healthcare in rural communities a health sector priority. This will be done by engaging members of the community and interdisciplinary team as it requires participation from sectors whose work aligns with key determinants of health. The focus will be on coming up with solutions regarding the difficulties in retaining healthcare providers to rural regions, such as long working hours, lack of colleagues to share the workload, lack of extra education, difficulties obtaining routine continuing education, and the perceived lack of opportunities for spouses and children. The next steps of the campaign will involve policy changes to develop and implement funding mechanisms to support health professionals for community care practices in rural communities, optimize the scope of practice and skill flexibility to support the rural primary and community practice model, develop incentive programs and support specifically for nursing and allied healthcare professionals to enable interprofessional models, and to expand education programs for nursing and other allied health professions in rural communities to promote career opportunities in healthcare.